Knock knock.
Enter.
Hello. Uh, how are you, sir?
Good, how are you?
My name is John. I am going to be your nurse for the day, and let me wash my hands real quick. Could you please tell me your name and date of birth, please?
I'm Charles Zonad, born on May 3rd, 1980.
All right. Thank you. Uh, and I'll check your wristband. It matches what you told me. All right. And this video is going to be recorded, if you don't mind, please. All right, so before we get started, I just have a few questions for you. Do you have any shortness of breath?
No.
Trouble breathing?
No.
Any cough?
No.
Any history of asthma?
No.
Are you able to lie flat in bed to sleep?
Yes.
All right, thank you so much. So next, I am going to observe for any breathing effort. And I'm going to observe for depth, pattern, retractions, use of accessory muscles, or tripoding. Okay, so I am going to observe you breathe for 15 seconds and I'll calculate that. Okay. All right, that was between 12 and 15, and I'm going to, when I multiply that by 15 to get your rate per minute, and that's within regular findings. Okay, so there was unlabored breathing, there is no masses, the lips appear nice and pink, no sign of cyanosis. So Ronnie, I am going to inspect your posterior thorax, please. Could you turn towards me, please? Okay, so all right, I am going to inspect for any color changes or lesions, assess the shape of the thorax, inspect the scapular alignment, and upon assessment, the skin color matches the ethnicity, there is no lesions present, the AP ratio is 1 to 2, and there is equal rise and fall of the scapula. So next, I am going to palpate the posterior thorax, starting from the cervical spine down to the intercostal space. So, do you have any pain?
No.
Let me know when you feel any pain, okay? How does that feel? Okay? Okay. All right. Any pain, any masses, tenderness that you feel around this area? No pain, nowhere. All right. And I'm also I'm going to palpate for tactile fremidas, and I am going to do the 8 spots. So while I'm doing that, I am going to ask that you say 99 for me, please. Okay. All right. Can you say 99?
99. 99. 99. 99. 99.
Okay. And all right. So there is no tenderness or masses, and there is symmetric expansion, and the tactile fremidas is equal bilaterally. So next, I am going to percuss your posterior your posterior thorax. Okay, and so starting right here. Okay. Moving on to the next intercostal space. Okay, sounds good. Okay, no bone right here. Okay. Okay, so there is no bone. All right. here. Okay. All right. There is upon percussion, there is normal resonance, and patient sounds like he's normal and not in any distress. So next I am going to osculate for any lung sounds. I am going to do the same spots that I just percussed right now, okay? All right. Of course, this should be on this directly on the skin, just to listen for any sounds. All right, now move on to doing this bilaterally, and I'll go on right here, and I'll move to this side. And move down here. Yep. Next stop is right here. And then next one right here. And right here. And then finally, and then on to this side, which is right here. And oh, you have clear, nice lung sounds from the apex to the base, and they're equal bilaterally. So Ronnie, next I am going to inspect your anterior thorax, please. Can you face towards me, please? All right. I am going to inspect for any skin color or changes or lesions. I'm going to inspect for shoulder alignment, and on inspection, the skin color matches ethnicity. No lesions are present. There is equal rise and fall of the shoulders. And next, I am going to palpate the anterior thorax, starting from the clavicles all the way to the intercostal spaces, to find any tenderness or masses. Okay, any pain? All right, patient reports that he's feeling all right. There is no tenderness or masses. So finally, I'm going to osculate for the lung sounds, and I am going to, Ronnie, I'm going to start by listening for any striders, and this is right here. Okay, that sounds good. And next I am going to listen right on the skin, and then onto the side, and I'll move to the next intercostal space, which is right here, and do this bilaterally, and on right here, and I'll do it bilaterally here, and then all right, all done. Do you have any questions for me, please?
No.
All right, thank you so much.